was an organization. IPPA was an organization that has been made to help Pakistanis in Ireland. We hope to raise the respect and honor of Pakistan and Ireland, and we're collaborating with multiple professional communities to help and create a peaceful and harmony and respect here in the Irish society so that we can all get along and keep going as it is. There are a few ground rules. I will ask everyone to adhere to this. I would please ask everyone to keep their mics on mute. Um, thank you. I encourage everyone to ask questions. Please put them in the chat box and we will try to answer them in the chat box. If we can take a few of them live and answer them, we will do that as well. But we will try to answer as many questions as possible. But I will request that everyone please put questions in the chat box and keep your mic on mute. This session will be recorded so that it can be used in the future and that people can benefit from it as well. Now, so I will give it another minute and then hopefully we'll start.
Yeah.
Okay. Just to reiterate again, please everyone keep their mics on mute. Please, you can feel free to use the chat box to ask questions and the session will be recorded. Now, on behalf of the IPPA, Assalamu alaikum, and I welcome you all to the Essentials Survival Guide to Starting a Career in Medicine in the Irish Healthcare System. I would ask the panel if they can open their videos just so I can introduce everyone and we can start the session. Myself, my name is Dr. Adil Zafar. I'm a consultant vascular surgeon in University Hospital Limerick. I'll be joined by Dr. Mohammed Shahid, who's a consultant anesthesiologist, and he is a co-lead for the IPPA Med. Years of experience in Ireland, and will be giving us an excellent talk as well. My colleague, Mr. Yasser Bashir, who I've worked with as a registrar and a consultant, he is a colorectal surgeon in Tullamore, has gone through the healthcare system in Ireland and gone through the ranks to become a consultant, will also be giving us valuable information and knowledge and experience. We're glad to be joined by Jamie Nugent, who is a part of the MPS, and she'll be giving an essential talk that is necessary for everyone to listen to understand what the MPS does and how it helps. And then Zainab Afzal, who is a junior doctor who has started in St. Vincent's Hospital in Dublin just a year ago and is well versed with what the problems here are. And she's thankfully come forward and willing to give and share her experience and to allow everyone to learn from this. So these are the esteemed panel that we'll be going through and we'll be asking questions in the background. We'll have
Yes.
Dr. Maksud, Dr. Mohammed, Professor
Good.
Mohammed Al-Mukhtar, and
Yeah.
Mustafa Mahmood.
My God.
They'll
Yeah.
all be there to help out and answer questions on the chat group as well. So without delaying any further, we'll hopefully get started. As a brief introduction, um, we realize that lots of people migrate and move and come from Pakistan to Ireland. Not only from Pakistan, people come from Sudan, Saudi Arabia, from other countries of the world, and they all come to Ireland to work in the medical professional. This is a big step. You're moving from one country to another. There's a different healthcare system in place. There's different procedures in place. There's even a different culture and different language in place. So to help with all of these, to navigate all of these, we put together this webinar. And we're hoping that it'll benefit people so that they don't go through the pitfalls that some of us went through and that may occur. We don't want to see any doctors up in the press for wrong reasons. We want everyone to get to have a good idea of what they're getting into and how to deal with it. This is the basis for this webinar, and we'll proceed with this. The first presenter that I'll be asking to come forward is Dr. Zainab Afzal. Zainab, are you there?
Yes.
So I'll
Hello.
hand over to Zainab Afzal.
Hello, everyone. Good morning. My name is Zainab, and I am working as a senior house officer at St. Vincent's University Hospital in the Department of Anesthesia. I welcome you all to this webinar today. And first of all, I'd like to thank the IPPA team for providing me this platform to speak about my experience. So I last moved to Ireland in July 2024 as part of the CPSP HSC exchange program, which most of you must be familiar with. So I started working here a year ago. It's been a year. There's a lot that I've learned, and there's a lot that I've experienced so far, and I'll be speaking about it today. So the first and the foremost thing that came as a surprise to me was the healthcare system and the environment in Ireland. It's a very, very professional and supervised environment, which makes it both safe for you as well as for the patients. The consultants are in a really close communication with you at all times, which is unfortunately not the case back home. So you have consultants available at almost all the times. If not on ground, they're just a call away. They're there to help you with your work-related issues, with your academics, like the audits, the researches. They make sure that you have all the help that you need to settle in well. Never hesitate in communicating with your consultants in here. This is not the case like back home, where you would be hesitating or giving it a second thought before ringing your consultants for an opinion. So this is one major difference that I found here. The other thing that I would like to mention regarding the healthcare system here is that the patients are very well educated and they're very well informed. So when you're dealing with your patient, just be mindful of this, because this might come as a challenge to you. Early on, make it a habit of documenting every single thing that you do. We don't religiously document things back home, and specifically in Pakistan. But this is not the case over here. Documentation is taken really seriously. And I would I would make really much emphasis on this, because if you don't document, this is going to go against you in legal matters. So just make sure you make it a habit of documenting early on when you start working in Ireland. The other thing that I would like to mention is relevant to all the specialities, you've got your guidelines, you've got your protocols. So just go through them, familiarize yourself with them before you start working here, because everybody here abides by the protocols and they would expect you to do the same as well. Another thing that I would like to mention, or that would be worth consideration, is depending on your past experience, just check in with your HR that you're put on the right pay scale. This is an issue that many trainees would face over here, including the Irish trainees. So just make sure with your HR that you are on the right pay scale depending on your years of experience. Also, the relocation stress. Yes, that is real. Unfortunately, and yes, we do struggle a lot with accommodation because of the ongoing housing crisis in Ireland. But there are a couple of things to look out, such as scams. They're real, and you might be caught into some scams. So just make sure you verify things before you get your hard-earned money into something. And there are a couple of platforms that you might look into for accommodation. That would include daft.ie. I'm sure you might be aware of that website or the app. There's Dr. Daft and Dr. Reese group on Facebook, and you might also post it on the IPPA group, which is going to be really helpful. And you might find somebody in the group that might be able to help you out with your accommodation. That's a couple of things to try out in terms of accommodation. Hopefully, you'll be able to get one in time. Yes, if you could move on to the next slide, Dr. Adil. So, what I've learned so far, talking about the adaptability. So, when I first moved to Ireland, it was not easy. The most challenging thing that I would say was the cultural difference for me. So, when I first came in, I felt like I did not belong to this place. I felt alone. I felt a lot homesick. I did not know anyone in Dublin. So, but when I started working, I did isolate myself. The main reason would be the Irish accent as well, which added to all the stress because I found it really hard to understand and communicate with my colleagues and my consultants who would have discussions on a fast pace. So that was really challenging for me and really was overwhelming at times. But as I said, it is a supervised environment, and I was given a college tutor who would help me out initially to settle in. And what he did was he introduced me to another consultant who's also from Pakistan in my department. And um, I cannot thank that tutor and that consultant enough because that was all that I needed to gain my confidence. I think I was losing all my confidence. I was not sure if I was doing well in anesthesia at all, but that was all I needed. So I just want you guys to know that you will have good people around you in the department. All you need to do is reach out to them. There's no hesitation in asking for help or asking your colleagues, or even if you do not understand anything, be it the accent or anything in general, you might just ask the patients or the colleagues or your consultants to repeat for you. People don't mind it at all, and they're going to do it for you, and you will eventually get there. You'll learn the accent, you'll learn how to communicate efficiently, and it's all up to you how sooner you adapt to these things around you and settle in well. If we go on to the next slide, Dr. Adil. So it's going to be a quick webinar. So I'm just going to leave here at a take-home message from this experience that I've had so far. So you need to step out of your comfort zone. You need to challenge yourself to be able to grow in your profession. And there's a lot of competition out there. So make sure you show interest. You're keen on learning. Ireland is a very resourceful country. You'll find a lot of things that you've not known before, that you've not used. Specifically, if I talk about anesthesia, there were a lot of medications, equipments, and monitoring that I had not used before. But the consultants here were really helpful. They taught me how to use it. It does not depend how much of anesthesia I had done in the past. So they're going to be people helpful. All you need to do is you need to show interest and you need to make the most out of this opportunity. And I would again and again say, it does not matter where you are, whether you're an SHO, whether you're a reg, or whether you have years of experience in your field. If ever in need of help, do ask for it. There's no harm, there's no hesitation in asking for help in here. You'll be surprised to see how the senior faculty can be helpful when you start working in Ireland. And the last but not least thing is that Ireland is a really small community, so your reputation is going to travel really quickly. All you need to be sure of is that you're respectful, you're honest, and you're professional in your behavior. Thank you all.
Thank you very much, Dr. Zainab. That was an excellent talk for all the junior doctors. These are the challenges that she faced in her first year here. And hopefully she'll go on to have an excellent career and an excellent next year here as well. Now, we're going on to the next part of the session, and this is a session where myself and Dr. Yasser will do a scenario, and we're going to do something different. We're going to allow you to pick out as many mistakes as we make. Please feel free to write all the mistakes we make on the chat room. You can say whatever you want about the mistakes we make on the chat room, and we'll try to go through them. This is a scenario we're designed so that you can learn from it, and hopefully will allow time for us to answer the questions and go through this. So myself and Dr. Yasser will be doing this. So Yasser will be the doctor and I'll be the patient, and we'll run through one scenario. Is that okay? And so Yasser, if you're happy to go ahead, we'll start.
Yes. Okay. So I'm a doctor in the emergency department. So good morning, Mr. Adil. How are you?
I'm good. How are you?
Good, good. What brought you to the hospital?
Oh, I've been having pain in my tummy for a while now.
Okay. And since how long do you have this pain?
Oh, it's been going on for 3 weeks now,
And
but worse
Mr.
over the last 2 days.
Hmm. So, Mr. Adil, what kind of a pain is that?
It's a very sharp pain and then it gets worse after I eat.
Okay. And Mr. Adil, is there any nausea or vomiting or anything of that sort?
There's nausea sometimes on and off, but vomiting very rarely.
Okay. So, Mr. Adil, can you lie down? I just want to feel your tummy.
Yeah, okay, sure.
Okay, now I'm going to press on your left side. Any pain here?
No, not much pain.
Okay, any pain in the middle of your tummy?
Yeah, very sore, yeah.
Okay, and coming on your left, on your right side from
Oh, that's
right
worse.
side.
That's a lot worse. That's
That's a
terrible.
lot worse. Okay, that is fine. Okay, so I'm now going to organize some blood tests and an ultrasound. And then I have a feeling you have a gallbladder issue. So let's run some tests and then we will be able to confirm what you are suffering from and how to deal with it. Is that okay?
Oh, yeah. Thank you very much, Yasser. No, Yasser staying on board. We have a few things on the chat box. Sorry, I'll just go through them now. But sorry, thanks.
Let's give them
I need
30
to get it.
seconds, Adil, and let's see if they can come up
Yeah.
with more
So,
ideas. So we're going to give you
so one
30
person
seconds.
has written, yeah, Dr. Malik
And then,
Maksud has answered for most people, but yeah, keep going. We'll give you 30, 40 seconds. See what you think. This is a free chance for you to criticize us. Okay. So, look. Mm, okay. So yeah, people are getting a few of the answers. So I'll give you one more 30 more seconds and then we'll start with going through these. Okay. So yeah, lots of people have given answers that we typically find. We did purposely shorten the history very quickly to run through because it's a webinar. We didn't go through the full past medical history and detailed history. We just wanted to keep it. But in ED, this can typically be the scenario of what can happen. Things that some people did pick up and some people didn't. One, the doctors always have to introduce themselves, and you have to ask the patient who they are. By introducing yourself, like Dr. Yasser said, I am Dr. Yasser. I am working as an ED registrar, SHO, or consultant. That would be the designation that has to be given. Even if you go to talk to into a patient, you need to explain to them who you are, what your role is, and what you do. Absolutely, some people did identify. You need to ask for consent before you do an examination. Now, in this scenario, Yasser said, could you lie down and I'll examine your tummy? That is still not good enough as a consent. We need to be very clear and tell them what you will be doing. You need to tell them, I'll be asking you to lie down. We'll be exposing you from here to here, and I'll be feeling your tummy and then using a stethoscope and then go through it. And those are the steps that you need to do to get a consent. Asking for a chaperone, absolutely 100% necessary. Does not matter if the patient is male or female, you need to have a chaperone. Unless they waive the right for a chaperone, you need to have a chaperone. I know lots of people think that if it's a female patient, that's only then that you need a chaperone, but no, you need to have a chaperone. Um,
Always offer at least.
yeah. And then one thing that is something that you do need to confirm is the gender. If Dr. Yasser referred to me as Mr. Adil, assuming that it's male gender, and if I identify as binary or neutral or them or their, you need to know this before you start. So asking them their pronouns or asking them how they'd like to be addressed is appropriate and it should be done. So these are a few of the things that we think that you should be highlighted. Privacy absolutely should be in a separate room. That absolutely should be done. Patient feeling pain, be aware of gender issues. Yeah. So most people have put those in. Those are the main things that we did want to highlight in this, and people they do get caught out in these things. Now, Mr. Yasser has a colleague that went through a certain experience and that he's going to share with us just for a learning experience, and it's around about similar grounds of what we've described. So, Yasser, I'll
So,
hand over to you.
yeah, so I had a very good friend and a very learned and experienced doctor who worked with me in Pakistan, and then we moved together to Ireland. He was working in a very busy emergency department in one of the regional hospitals where there was some issue with the staffing. So to make things efficient, he delegated a lot of work to the nurses. So he was running short of people to come with him. And when he examined one of the patients, he did a respiratory examination on the patient without a chaperone. The patient complained about the doctor that he has sexually assaulted him. Um, Although there was no evidence of it, the district attorney had to look at all the evidence, interview everyone, and then he found out that no, there was no misconduct from the doctor. There is no sexual assault on the patient, and he waived the case. So there was no case, but that period, that doctor was under immense stress. He was not covered by his clinical indemnity scheme, so he has to hire his own doctor, the whole solicitor at the time, and whatever he paid, I was not aware of that how much he paid for that. Then this doctor went on to a different jurisdiction, left Ireland and started working. And during that time, he was referred to the Irish Medical Council by the hospital. There was a case there, and that for that barrister who was representing him in Irish Medical Council, $25,000 he transferred to me, and I passed on to that barrister. Whatever else he has paid to that barrister, I have no idea. So it was a very expensive mistake which he had to tolerate. He was acquitted of everything, of no wrongdoing found. Still, it was a very expensive mistake. He tried to make the things smooth line and more efficient, resulting in cutting corners and paying the price. So, if you think that you're short-staffed and you want to make things more efficient by cutting corners, don't do that. If the system is under resourced, it's not your problem. You have to do the things by the book. You have to be very careful that if you do something to make things more efficient and something goes wrong, system is not going to protect you. So you have to look after yourself.
Thank you very much, Yasser. That is a relevant case. It is a real life case. It has happened, and it was something that's simple in Pakistan. We would do all the time to save time. We'd go examine the patient, not to care for a chaperone, not to care for what's required, because we're trying to save time and keep the system moving and keep patients going around. But this is not appropriate for the patient. I know we can justify it as doctors as we're trying to get the work done and get the hospital road ticking over, but it is not appropriate for the patient. And at the end of the day, the patient is what is necessary. Now, I'll hand over to Dr. Mohammed Shahid, who's a consultant anesthetist. He'll be going through the importance of documentation for us. Dr. Shahid, if you're there.
Yes, I am here. And thank you very much for this opportunity. And I think after this lovely case scenario, the ground is already set for me to go on this important topic, which is a documentation. So please, can you move to the first slide? Well, the most important here is what is the good clinical documentation. It is important for delivering the safe and effective patient care it plays a vital role in supporting the clinical decision making and also ensuring the continuity of care across teams and services. The accurate record keeping helps the doctor to meet their legal, ethical, and professional obligations and offer protection in the event of any complaints, investigations, or any medical legal proceedings. That's why it is more important that we have to be very clear in our clinical documentation. High quality documentation supports the clinical audits, research, service planning, and also the ongoing quality improvement within the healthcare system. Can we move to the next slide, please? There are certain core principles on which your good documentation is based. So I want to take them one by one, and I want to be brief and will leave you to think about it. The effective documentation should be accurate. It should reflect the facts truthfully. There should be no guesswork involved here, no assumptions and no speculations. And most important is that it should be very clear documentation. And another important thing that it should be legible. These are the two key principles. It should be clear and should be legible. These entries must be easy to read and understand, also using the standard abbreviation. Nowadays, we are picking up the habits of putting up the different abbreviations, so the standard abbreviation should be used, which can be understandable to the others. And these documentation should be completed promptly, and ideally it should be immediately after the clinical encounter and should be in the chronological order. And all records should be complete, should be relevant, covering the patient history, examination, findings, diagnosis, any investigation you have done, or any treatment plans, or if have any discussion with your consultant colleagues or your seniors, that care plan should also be mentioned in your documentation clearly and legibly. Can I move to the next slide, please? Professionalism, confidentiality, these are the core principles. And there are certain rules and regulations which I will go through for you to have a look into when you will be starting the job. And the clinical notes should be professional. Professional means that it should be objective and respectful and free from any personal or inappropriate comments. Confidentiality is paramount. You have to maintain the confidentiality in keeping all the record, and the record should be compliant with the data protection regulations, which are called as the GDPR. So it is the obligation on us to keep the confidentiality. And every entry should be clearly identified, both for the patient and the author. And the author who is writing these notes should have to have mentioned the full name, the professional role, the date when he has mentioned the notes, and the time when he is putting the record. And the document should be audit ready. That if at any stage later on they want to do the audit on that document, it should be audit ready. And the scrutiny, and it's also be relied upon in the legal and professional reviews. Always remember that the documentation enhances the communication within the clinical teams and ensure the safe handover and follow-up care of the patient. So your professionalism, your confidentiality, and the sense of accountability should be there when you are documenting these important patient notes. Can I have the next slide, please? There is the website resource by the Health Service Executive, which is called as the HSE Land, and you have the mandatory courses available on that HSE Land, and then you have to do those courses in order to get yourself familiarized with the system. HSE National Standards of Clinical Record Keeping is available, Medical Council guidelines are available, and the GDPR Act 2018 is also available. And there's the Health Improvement and Quality Authority is there as well, which is keeping a track of everything. That is why you have to be very vigilant and you have to be very professional when you are keeping the record. I will pass you on to Adil. Adil, please carry on.
Yeah, thank you very much, Dr. Shahid. And Dr. Shahid has gone through a very, very, very important aspect, and that most doctors are very lazy at. I'm not going to say Pakistani only. Everyone is a bit lazy at their documentation. They like to keep the ball going, keep everything going, and keep active. Sitting down and documenting things is difficult at best of times, but it is essential. That's the only way we keep records. That's the only way we make sure that we know what's happening and that plans can be intervened. This is a simple example of a documentation that is done almost daily in theaters everywhere. And it's not only done by the anesthetist, but it can be done by the surgeon, it can be done by the nurse. Uh, these are absolutely essential documents that all of us have to go through. There are documents like this on the ward, there are documents like this in the ED, and if they're essential, you need to have them documented clearly, demonstrating the name and person who has done them and reasons. Next, I'll be handing over to Jamie Nugent from the MPS, and she'll be going through the medical protection and the indemnity in Ireland. I would tell everyone to listen up as this is very important. Thank you, Jamie. I'll hand over to you.
So, hello everyone, as Adil mentioned, my name is Jamie Nugent and I am part of an organisation known as Medical Protection Society. For short, in Ireland, as an abbreviation, you may hear us refer to as MPS. Next slide, please, Adil. So who are MPS? We are a medical defence organisation, and what that means is we legally protect doctors throughout their career. We do this by offering a product called occurrence-based medical indemnity. And what that means basically is if you join in membership today with MPS and you go out tomorrow and you see and treat a patient and something goes wrong, you make a mistake, whatever it may be, fast forward a couple of years later and you're no longer a member with MPS. It could be for whatever reason, a career break, retirement, whatever it may be. If you receive notification of a claim or a complaint from the patient that you saw and treated tomorrow, you're still protected. So you're protected for anything that happens within your membership, if that makes sense. We are also a not-for-profit, so we do not exist to make money off anyone. The sole purpose of our organisation is to provide the protection for doctors in Ireland to allow them to do their job with peace of mind and comfort at ease every day. Next slide, please. So we're here to protect you. We are here before a complaint arises, before a claim comes in against you, and before an issue basically escalates. If you just go to the next slide there, Adil, please. What we mean by this basically is the moment you decide that you need our help, our guidance, we're there to support you. These are a list of many of our resources that we have in place for our doctor members, but particularly to focus for yourselves, the 24/7 free phone support line is essential. We advocate all our members to use this whenever they feel they need advice. At the other end of this phone, line is medical legal advisors. So these are medically trained and legally trained professionals. They're wearing the shoes of both jobs. There's no one better to speak to in a tricky situation. We also, just a few of the things, instead of listing through, calling them all out, a few things to notice is we help with coroner's inquest report writing, which is particularly extremely essential in Ireland, and it's becoming more busy. Gardaí investigations, anything medical and legal in Ireland, whether it be a crash, an accident, they all interlink, and we help with support on that. Next slide, please. So, as a HSE public sector doctor, why do you need membership with MPS? Because you are coming in to work under the clinical indemnity scheme, which is basically the state indemnity, which is provided to all HSE staff. And I often explain this as if you put yourself in the shoes of a patient and you're unwell and you go to a hospital, you're immediately at ease because you're in the right place. But the reality is, without your one-to-one doctor talk, without that investigation that the doctor puts in place for you to put a plan together to help you, there's no, you needn't bother going to the hospital. So even if you're in the hospital, you still need that doctor investigation. And I often refer to the clinical indemnity scheme as the hospital. Yes, it brings a sense of ease to the staff, but you still need that one-to-one professionalism who's there to support you as an individual and only care for your needs. Just a call out here, if you only work under the clinical indemnity scheme and you find yourself getting called for a fitness to practice investigation in Ireland, you won't have change. This will cost you out of your own pocket, and you will not have change of €80,000 in today's world. It's very expensive. Legal fees and legal representation over in Ireland is extremely expensive. Next slide, please. This is just a case study that I've popped in just to go through the difference between an issue that arose and a doctor who had medical MPS membership versus had they only been working under the clinical indemnity scheme. So basically what happened here, without reading through it fully, a doctor was working a very busy A&E and a patient came in showing signs of alcohol, just being drunk. There was a fruity smell of the patient's breath. And because of his state, it was very difficult for the doctor to take proper notes, proper medical notes. He had a brief look over his history and thought that this patient particularly had a history with alcoholism. So he presumed that it was alcohol. He ordered bloods, brought him to a quiet corner of the hospital, of the A&E, and allowed him to sleep it off, and left in his notes to follow up with the patient a couple of hours later. Unfortunately, when he came back to the patient had actually lost his life, and he had been suffering with something called, now I hope I get the pronunciation right, ketoacidosis, which I'm sure you're all aware is a side effect of a diabetic. So next slide, please. So this is just a layout of the outcome, the two outcomes, had it just been the doctor under clinical state indemnity versus having his own MPS membership. So if we just go through the clinical indemnity scheme, which is basically he doesn't have his own personal indemnity. His employer, so the hospital, wasn't able to provide him with the proper support that he needed. The hospital's internal review happened months after the death of the patient, and the notes, it had been come to the awareness that the notes of that patient particularly had gone missing, which I don't work in a hospital, but I've heard is not uncommon to happen. The patient's family then brought a claim against the hospital, and the hospital solicitors acting on behalf of the HSE. So this is vital to be aware of. Under the clinical indemnity scheme, the sole purpose of that is to protect patients and the state, which is the HSE. You are not their best interests, which is sad, but it's true. It is up to you to protect yourself. So he's working, the solicitors acting on behalf of the HSE requested a statement from the doctor, but because the medical notes had gone missing, it made it very difficult for the doctor to defend his action. The family then brought a complaint to the Irish Medical Council about this doctor, and he was brought up to a fitness to practice investigation, where he did not have legal representation, or if he needed it, he was going to have to pay €80,000 out of his own pocket, which I don't have €80,000 to spare to throw away at legal fees, and I'm sure you won't either. The outcome as MPS indemnity was basically immediately when the issue happened, when he found the patient dead, he contacted our 24 free phone support line and immediately spoke with the medical legal team, who provided him advice. So immediately set him on the path to extinguish the outcome, the most likely outcome that was coming his way in his future. MPS recommended the doctor to write a full draft report of the day. So when we say this, I always say, don't leave anything else. If A&E was extra busy because it was cold and flu season, if their staff, like staff out sick or whatever, and you're just busy, make sure to just talk about everything, basically. So he was recommended to write up a full draft report of his day and the circumstances that led to the patient's death. At the hospital internal review then, MPS provided the team with a copy of the notes and the draft report written by the doctor. MPS then guided the doctor through the IMC complaint process, so basically advised him what to expect, what would happen, set him up to know what would happen, because I've heard you will be interrogated. It's lonely and it's a scary thing to come up against. So we made him aware as to what was going to take place, and then he had his own legal team to represent him in there. And then our press office, we also have a press office which helps with unwanted media attention, whether it gets into the paper, the news, whatever. And as Zainab said earlier, Ireland is a very small country. Everyone knows everyone. It feels like your representation will travel quite quickly. So we helped to deal with that. And then following the ordeal, it can sometimes bring mental health issues for doctors who have gone through something like this. And he had access to our free phone confidential counselling service. And then it was just agreed that the doctor would do some learning and self-improvement courses and attended a few risk-free management webinars provided by ourselves. Now, if you go on to the next slide, please. If anyone has any questions about anything I spoke of so far, just drop them in the message box. So this is a QR code for a web page that we have set up for IMGs, coming over, trying to navigate the HSE, a different culture, a different language, a different accent, as I've learned on this call, can be quite challenging, and it can be very lonely. So this is a page that we've set up specifically for our overseas doctors. And there's just a few useful links, tips, guidance navigating the HSE. I'll leave that QR code up for a couple of seconds if anyone wants to just scan it and take a picture. So the next slide, please, Adil. Now, this is a QR code for those of you on the call who need indemnity and need to join. I had a question earlier in the little question box asking, I'm an SHO, do I need indemnity? The answer is everybody needs indemnity in Ireland. We provide students, medical students from as early as year 1 with medical indemnity. So yes, regardless of title, regardless of whether you're only working in the HSE versus doing private hours, you need indemnity. The clinical indemnity scheme is not in place to support you if you found yourself under investigation. You need your own legal support. This is a QR code on how to join. As a massive thank you to the IPPA for allowing us to talk today, we actually have put a discount in place for all IPPA joiners to medical protection. It's a 10% discount off basically your price. For an NCHD, for a special reg or a registrar, roughly you're looking at €519 for a year's membership. For an SHO, roughly you're looking at €205. So you can expect to pay anywhere between €205 to €519 as a standard rate. But we've now, for your first year joining, we've offered a 10% discount on your membership fee. We also have in place a 2-month subscription deferral. So basically what that means is you can join with ourselves if your start date, let's say it's the 10th of July, you can email myself now to get yourself set up so that your membership kicks in from the 10th of July, but your direct debit payments won't start till 2 months after, if that makes sense. So it kind of just frees up the pockets a little bit, not much, but every little helps when you're taking on a big move to a different country, especially Ireland, where it's extremely expensive. How to avail of the discount and the deferral: basically scan this QR code, submit your application online, and as soon as you have submitted your application online, you need to email me. And in the email, you need to call out that you are part of the IPPA group. And just advise that you submitted your application, give your, obviously, if your name's not in your email, give me your name, and just call out that you're in the IPPA group. I'll then work with the team to ensure your membership is set up basically to reflect that. This is only valid, I just want to call out, actually, I've missed this. This is only valid for your first year of membership. and the discount ends on the 31st of July. So your membership needs to be set up before the end of July to avail of the discount. Has anybody got any questions on medical indemnity so far? I don't want to scare the life out of you coming over to Ireland. Ireland is a very litigious country, meaning patients will claim and complain quite a lot. It can be a very vulnerable space to work in, particularly for overseas doctors, when there's a language barrier, miscommunication, everything like that. So just ensure you're set up on the right path from the get-go and you're well protected. Protect yourselves, your career, and just go to work with peace of mind that if you make a mistake or something happens or a complaint comes in, you have the MPS membership and you have the support when you need it. My email is there. So if anyone wants to take a picture of my email so that you can make sure when you join up in, I just see a question there. I'll be joining as an SHO late August. That's okay, you can join then, but if you submit your application now with your start date in August and email me, it's just to get the discount, you need to submit the application before the end of July. So I'll still be able to help you avail of the discount. I just need you to submit the application in before the end of July.
Thank you very much, Jamie. That was an excellent talk. Just a few questions that I picked up on. If people are already SHOs and Regis and they need a cover, will the cover backdate?
No, so we don't provide backdate for, all I will say to you is just get it now. If you're currently in Ireland, working in Ireland without indemnity, and don't worry, there's so many in the country, particularly the overseas, there's a trend, sorry, excuse me, there's a trend with our IMGs not having this because their HSC contract tells them that the clinical indemnity scheme basically is what they need, but it's not. And until they come into the country and work with consultants and colleagues who advise them of medical indemnity and the importance of it, a lot of people don't know. So if you are in Ireland currently working and you don't have it, no, we can't backdate it, but get it now. Submit your application now.
Can I ask if someone's working a locum job, you'll still cover that as well?
That is a review. So that basically has to be reviewed by the team. I suggest if anyone is working a locum job, just email me directly. It has to be kind of looked into as an individual basis.
Okay.
So Zanara has a question there, and Zanara, I'm going to answer that instead of Jamie. So your IMG contract says, IMC portal says it's NCHD indemnity is provided by state. So state indemnity is the clinical indemnity scheme. Clinical indemnity scheme is primarily to protect the interests of the hospital. So if the interest of the hospital aligns with protecting you, that's fine. But if the interest of the hospital is to put a blame on you and to have a court settlement outside, they're going to do it. So clinical indemnity scheme primarily settles claims on behalf of the hospital. And most of the time, they pay the patients off to protect the hospital, even if that involves saying that, yes, it was the doctor's fault. Hence, you need two separate indemnity. CIS is to protect the hospital, and you will, if you are in a HSC contract, you'll already be having CIS. But if you have anything else that happens that doesn't align with the interest of the hospital, CIS will not protect you. If a patient complains against you in the medical council, the clinical indemnity scheme does not protect you. If a patient complains to the guards, for example, sexual assault or physical assault, which to your surprise is not uncommon, your clinical indemnity scheme will not protect you. If a patient writes a complaint letter against you and you have to answer that, clinical indemnity scheme will not assist you in writing that letter. All those services are provided by MPS at no additional charges. For SHO, I think it's about 200. For a registrar, it's about 500. So it is less than the cost of a takeaway that you're going to eat per month. So it is extremely important. I cannot stress enough because as a part of my job, I deal with a lot of IMGs and I've seen a lot of Pakistani and other international medical graduates in front of the police, in front of the courts, having to leave the country because they did not have supplemental indemnity. So, if there's one big take home message today, all of you should sign up for supplemental indemnity today.
Thank you very much, Mustafa. I agree with Mustafa wholeheartedly. This is absolutely necessary and should be done. The summary from this webinar and the take-home messages, and just before I say thank you to everyone, medical indemnity is essential. I do not think it's an optional thing. It is something essential. I know people are told, look, you don't need to have it. You're only here for a year or 2 years. Doesn't matter. In those 2 years, if something were to happen and you don't have the backup, like Jamie said, none of us have 80,000 euros spare to spend on courts and cases. I think coming from Zainab's point of view, I absolutely 100% agree. If you're struggling in the hospital with patients or with colleagues, you have people to ask. Ask for help. Do not be worried about that. Ask for help. Someone will be able to help you out. Documentation, chaperone, and consent are all essential, and we've gone through them again. And I think that's very, very important. And to keep that in mind in the back of the head, those are things that we take for granted in Pakistan. Having worked there as well, documentation, chaperone, and consent are at the back of our head, but they're not in the forefront. And this in Ireland, you should be in the forefront. Patients come first, and you do need to be safe about the way you practice. So I'd like to thank everyone on the panel. Everyone, excellent job. Now we will take question and answers. I would request that everyone put it on the chat box. We'll try to answer them the best we can. Some of them I'll take orally here as well. Go through them. I will be giving the IPPA contact detail after this in the next slide, so you'll have that as well. We've gone through the cost as well. Uh,
Yeah. Adil, can I add something here?
yeah,
A lot of
absolutely.
the
Yes, sir.
people, when they register for Irish Medical Council, because we get registered with the Irish Medical Council based on the clinical indemnity scheme, a lot of the people think that that is enough. And the advice many time people get is that, oh, you don't need a second one until you get into trouble. But the problem is when you get into trouble, it's too late to get a indemnity at that stage. And as Mustafa said that if the hospital's benefits aligns with you, CIS will cover you. But if it does not aligns with you, they definitely will throw you under the bus and they will protect the hospital's interest at that cost. There are few areas where CIS is not going to protect you. They are not going to give you cover, and then you will be left to hang there, and you will be looking for solicitors and things like that. Uh, Guards are one example. The because many patients will go to very funny kind of avenues to get help, and then you will not be covered over there. So it's a very small cost for a peace of mind, which has no you can say you can't put a cost on the peace of mind. When you go home, you don't have to worry about your work at home.
And again, with Yasser, Dr. Malik Maksud has pointed out a very important point. Do never share patient details over WhatsApp or other social media without patient's consent. That is very, very, very essential. Please be careful with where you send patient details. Data protection website will have those details, and you have to do a quick course on it anyway. But make sure that you go through it. Jamie has shared her email and addresses. Um, the IPPA membership details are on the website. Once you click on them, you should be able to find them. So again, I'd like to thank everyone on the panel. Thank you very much for Jamie for coming up to talk about the MPS and informing of us, giving us all the details. And thank you very much for IPPA in the background on working on this to get the discount for everyone that's coming in and to get 2 months to everyone that's walking into the country can get MPS now. So when they start their job, they will be covered. So even if something happened on the first day of their work, they will be covered. So thank you very, very much, IPP and Mustafa specifically for helping to organize that.
Okay,
Thank you, Jamie,
there
for
are
helping with that.
few questions on the chat box, I think that need to be addressed. So I think starting from the first one that I'm just looking at, so there is a question about gender identity and how do you, some people haven't joined. So as Adil mentioned in his talk that there people in Ireland can not necessarily, if someone looks like a male and talks like a male, they might not be male, they might be non-binary, they might be cisgender. I've shared a few links on the chat box. Please go through them in terms of how do people identify. Never identify and never ask anyone by Miss or Mr. Just ask them by name. Michael, how are you doing? John, how are you keeping? Jamie, how are you keeping? Mary, how are you keeping? Miss Mary or Doctor, and this is something that is built into us that when we see a patient, we always want to add Mr., Miss, Mrs. before their name. So do not add a gender discriminator before their name. If you really want to, you can ask them, how do you want to be addressed? Do you go by Miss? Do you go by Mr.? They'll say, oh, just call me Michael. And that is fine. But do not put anything before that because a lot of your patients can be offended. Similarly, if you are taking a history that might have a sexual context to it, you can ask, how do you identify what is your gender? Beware of LGBTQI, the people who are from various different sort of sexual practices and their clinical presentations and their mental presentations. A lot of things are very different, and they can get, your how do you approach them can be at times perceived as offensive, and they can write a complaint against you to the hospital or to the medical council as well. So please read through how to use pronouns and how to identify people. And it is really, really important. It might seem like something that is very small and short, but this is something where you start your conversation with the patient. So please go through that. I've shared two links there. If someone doesn't have them, just go through the chat box. There is this, what is gender identity and why do you use pronouns? It's a really good article on RT, and you should all read this. Then there is a question about professional indemnity, which we have covered a lot. And as I said again, you need to get professional indemnity. There is MPS, there's MDU, there are other providers. MPS provides a lot of other things on top of indemnity. That is why I have MPS, but feel free to jump around and chop around. But as I said, there's discounts and all going with it. Chaperone, again, extremely important, extremely important. Do not go without chaperone. Whether even if you're, examining as something as small as someone's abdomen or a knee or anywhere where you have to touch the patient or take off their clothes or shirts or arm, always ask the patient, ask the nurse, make sure, and if there is no chaperone present, make sure that the nurse is there, the nursing in charge, that I cannot examine the patient without this, even if the patient dies, because currently there are 5 or 6 or 7 separate international medical graduates who are going through something related to chaperone, either in the court or the medical council or elsewhere. So it is the most important thing.
Thank you very much, Mr. I agree with all of that. I do agree having a chaperone is essential. I work in vascular and we examine people's feet all the time, but even for that, we have chaperones available. Um, Anything you need to have chaperones, you need to have yourself covered and you need to have it documented that you had a chaperone in the room.
Absolutely, that's important to
Um,
have the name and the title of the chaperone. So, uh, abdomen examined, findings chaperoned by nurse, this and this. And that has to go into the notes. As Dr. Maksud said, care not documented is care not given.
yeah, exactly. So please be careful of all of those things. Um, The IPPA is available, and we will, if you go to the websites, there's definitely people that will help with career progression and give advice. We have a mentoring program up. Um, MPS is the one that I have as well, the same as Mustafa. I think it's the most common one we have, but there are more on the market. I would recommend MPS for the ease that I've been having, but obviously it's up to yourself and your discretion. But we would recommend to get cover or indemnity. Again,
Supplemental
I'd like to
indemnity is extremely important. Uh, and when you'll come into the hospital, some of your colleagues will tell you that, oh, you know what? Why are you spending this amount of money on this? It's not important. Nothing ever happens. Nothing ever happens up until it happens. And when it happens, then you're left helpless. The hospital doesn't help you. Your colleagues can't help you. You certainly will not have the money to help yourself. And there have been instances where people have been asked to go on administrative leave or have been sent home that, you know what, you cannot work up until this issue is resolved, and you're not earning, you're not getting your overtime, you're not getting any money, and then you're trying to gather this resource to get legal support, or trying to figure out, oh, how should I answer this letter? Or, someone has written, a solicitor has approached me to write a medical report, or the coroner wants to me to write a report about someone's death, a patient that I saw. Now, some of them might not be a punitive thing, but not having that support to help you with writing those letters or responding to them. So it is extremely important that you have supplemental medical indemnity in one shape or form.
Okay, thank you very much. Thank you to everyone on the panel for being here and giving their time on a Saturday morning. Thank you, Dr. Shahid, Zainab Afzal, Yasser Bashir. Thank you all for joining and doing this webinar. I would ask if there's any last minute questions, by all means, go ahead. Otherwise, I'll ask the panel to stay on board and we'll ask everyone else to exit the meeting.
Finally, if people don't mind, we might share your emails with the Medical Protection Service so that they can contact you directly. Because a lot of you would find difficult to navigate the websites, etc. So if there is no, if anyone has any concerns about their email being shared, please let us know now. Otherwise, we will be sharing the emails with them so that they can contact you directly in terms of giving you access to the portal and guiding you through how to get indemnity. We have your emails through the ones that you have registered. So if anyone has any, if no one responds to this chat box, then I would assume that you have consented for your email to be shared.
Sorry, Mustafa, can I say one thing, please?
Yes.
If the people doesn't want to share the email, they can write to the IPA email address that we don't want to share, And if we didn't hear anything from the personal level, that it means everyone consented to share.
Thank you, those who are writing your emails here. I have a record of your emails the way you have registered for them, so I'll be using those emails. Unfortunately, I wouldn't be able to copy or paste any emails that are being shared, but I'll share those emails with you. This is our email address. So if anyone doesn't want, in next 48 hours by Monday afternoon, Monday evening, you can write to this email address. If you don't want your details to be shared, if they aren't shared, then if there's no further email, we'll be sharing the rest of the emails with MPS. Adil, over to you.
Yeah, thank you. Thank you again for everyone that's joined in. Hopefully we'll leave the panel on board and then everyone else will slowly leave. Noreen, if you go to the IPPA website, Dr. Noreen Nadeem, if you go to the IPPA website, there's a link to click and that'll get you into the membership page. IPPA is separate to the MPS. There's two separate bodies. So yes, to be a member of the IPA is a separate link, and MPS is different. I'll ask again if people are happy, they can start exiting the group. Otherwise, in the next minute or two, I'll start removing people from the group. Any questions, please go ahead.